Query from Sonipat, Haryana, unable to quote money to patient, have this feeling that she might go away. I'm also not much aware of charges taken by dentists in my area. My clinic is not fancy. It is simple, normal simple two rooms with normal rooms, AC, yes. Footfall is very minimal. So if some of you who has been regularly attending the pain points, you must have now realized that the patterns are the same. The problems are more or less the same. It is just the presentation of the participants. It is in a different way. That insecurity of losing the patients, that you can say feeling of missing out, whether I'm charging more or less or similar to my people in my area. Surface area or carpet area being equatable to the footfall. All these things are myths. I have detailed enough on that today. You have to shun the insecurity of leaving that patient. Even if you don't know what charges are your neighboring dentist taking, go to my videos, costing videos, open them, calculate your costing first, and then arrive at your treatment charges rather than looking at your neighbors. For example, something is costing you 2,000 rupees, for example, a PFM crown, but the price in your area is 1,800 rupees. Will you do it in 1,800 because the neighboring dentist is charging that? Will you put in, rather than earning, you will put from your pocket, and the end, next year your pain point would be, I'm having good patients, I'm charging also as per my neighboring dentist, but I still don't take home much money. I fail to think that even after having so many patients and so much good OPD, where is the money going from my clinic? Next year, you're going to have this pain point. Even with good OPD, good and charges equivalent to your neighboring areas. And maybe by then, you have invested certain things in your setup also to make it a little fancy. ये line मैंने सबसे ज़्यादा बार बोली होगी. You don't need a fancy interior. You don't need flashy interiors. It should be cozy, comfortable, decent, neat and clean. पर्दे गंदे ना हो, ब्लाइंड कटे फटे ना हो, सोफाज आपके होल्स ना हो या सीट्स फटी ना हो. All those things you have to make sure. It should be decent, nice looking. Want to increase my income? ऐसे तो नहीं होगी. जो आपने ऊपर पॉइंट्स दिए उनसे तो बिल्कुल नहीं होगी. And this is not a 1 degree shift. This is at least a 30 degree shift that you require. लोगों की जान निकल जाती है 1 degree shift में. So are you ready to make that 30 degree shift in your practice? Other than the marketing, other than the visibility part, ask yourself.